It's frankly difficult to understand how a year since the first vaccines were administered, 3 in 4 health workers in Africa remain unvaccinated. While some countries are now rolling out blanket booster programs, only half of WHO's member states have been able to reach the target of vaccinating 40% of their populations by the end of the year because of distortions in global supply. Enough vaccines were administered globally this year that the 40% target could have been reached in every country by September, if those vaccines had been distributed equitably through COVAX and AVAT. We are encouraged that supply is improving. Today, COVAX shipped its 800 million vaccine doses. Half of those doses have been shipped in the past 3 months. Our projections show that supply should be sufficient to vaccinate the entire global adult population and to give boosters to high-risk populations by the first quarter of 2022. However, only later in 2022 will supply be sufficient for extensive use of boosters in all adults. So I call once again on countries and manufacturers to prioritize COVAX and AVAT and to work together to support those who are furthest behind. Today, the WHO Strategic Advisory Group of Experts on Immunization, or SAGE, is issuing an interim statement on booster doses. SAGE concluded that the focus of immunization must remain on decreasing deaths and severe disease, and expressed concern that blanket booster programs will exacerbate vaccine inequity. About 20% of all vaccine doses administered every day are currently being given as boosters or additional doses. Blanket booster programs are likely to prolong the pandemic rather than ending it by diverting supply to countries that already have high levels of vaccination coverage, giving the virus more opportunity to spread and mutate. It's important to remember that the vast majority of hospitalizations and deaths are in unvaccinated people, not unboosted people. And we must be very clear that the vaccines we have remain effective against both the Delta and Omicron variants. The global priority must be to support all countries to reach the 40% target as quickly as possible and the 70% target by the middle of this year. No country can boost its way out of the pandemic. And boosters cannot be seen as a ticket to go ahead with the planned celebrations without the need for other precautions.